I'm Mrs. Janet Ephraim. My presentation is on documentation of theory in nursing management, a tool for quality care and identification of clear nursing role among the healthcare team. I am taking MSc Nursing with registration number 14026. I wish to present the paper in the conference. Okay. Application of theory in nursing care management of our clients or patients will enhance quality nursing care practice and give holistic care to the client and patient. Florence Nightingale, the mother of modern nursing, uses theory and collects data for documentation and use, which help her to achieve the standard of the modern nursing we are practicing today. Keywords: application, theory, nursing management, identification, clear nursing role, and healthcare. Introduction. One of the reasons of my choosing this topic is to remind ourselves at the high point or level of the nursing profession the importance of the use of theory and documentation of clients and patients in our clinical areas. Therefore, at the end of this scientific workshop, those of us in the clinical area will be able to implement various theories in managing our clients and patients. Theory is a formal set of ideas that is intended to explain why something happens or exists. Oxford Advanced Learner Dictionary 2010. Theories and nursing care plan are necessary tools for holistic care of patient nursing care. Therefore, one cannot be a competent and proficient nurse or midwife unless he or she understands the concepts of the use of theories and nursing care plan for clients in the two areas. He will then therefore be able to meet the total needs of his or her clients physically, mentally, and psychologically. Nursing. Nursing is the profession of performing the function of a nurse. Villas Nursing Dictionary 2009. A process of providing services that are essential to or helpful in the promotion, maintenance, and restoration of health and well-being. While a nurse is a person who is qualified in the art and science of nursing and meets certain prescribed standards of education and clinical competence, and is registered with the Nursing and Midwifery Council of her or his country. Villas Dictionary for Nurses and Healthcare Workers 2009. Documentation. In terms of job identification of the nurses from other health team workers, implementation of theory, if well documented, will show all the nurse has done to the patient that is clearly nursing care activities in nature. This will go a long way in identifying our role as nurses in patient care if only our nurses will change their attitude toward the implementation in their nursing practice. Theory is derived from the Greek word theoria, signifying a vision. With the concept of nursing, Hellinger views theories as a set of interrelated concepts that give a systematic view of phenomena. They are observable facts of events that are explanatory and predictive in nature. It can also be defined as a systematic way of looking at the world in order to describe, explain, predict, or control it. Brief historical development of theories. According to Porter and Perry, 1993, a review of the last 120 years has witnessed a demonstration of a growing body of knowledge in nursing. The genesis need for theory in nursing can be traced to the mother of modern nursing, Florence Nightingale, 1860, who advocated for professional knowledge. Her practice was based on taking care of the environment while nature is allowed to look after the physiological process in the client. After her demise, nursing lost the tempo and drive is still by Nightingale until the middle 1950s. This was due to the Second World War and economic recession. Theory drive. The drive for theory development was emphasized in the 1960s to 70s. Nursing was further defined as a process rather than an end, an interaction rather than content, and a relationship between two human beings rather than an interaction between unrelated nurse and patient. In 1965, also, American Nurses Association (ANA) position paper emphasized that the goal for nursing was theory development. In the USA, federal support was given for degrees in nursing. Series of symposia were also organized for theory development by National Legion for Nurses between 1960 and 1970. Theory can be described, explained, and predicted. Theories are testable. They are needed by all disciplines. They are needed for research, and theories are needed for practice. Some of the characteristics of theories as an interrelated concepts are: they are interrelating concepts to create a different view of the phenomenon. Theories must be logical in nature. This involves orderly reasoning, and the interrelationship between the concepts must be sequential. Theories should be relatively simple yet generalizable. Theories can be utilized by the practitioner to guide and improve practice. Theories must be consistent with other theories. It is utilized in designing models for nursing practice. Theory guides nursing practice either in health promotion, maintenance, or restoration. It guides future direction for research for improvement of care. Theory also assists to identify domains and goals of nursing practice. Florence Nightingale.
Janet, what happened?
The following nursing models are imperative in application of theory in nursing and midwifery. Theory of Florence Nightingale and her life brief history. Date of last review was January 31st, 2012. The goal of nursing is to put the patient in the best condition for nature to act upon him. Florence Nightingale. She was born 12th May 1820. She is the founder of modern nursing, the first nursing theorist, also known as the Lady with the Lamp. She explained her environmental theories in her famous book, Notes on Nursing, with title What It Is, What It Is Not. She was the first to propose nursing required specific education and training. Her contribution during Premier War is well known. She was a statistician using bar and pie charts, highlighting key points. International Nurses Day, May 12, is observed in respect to her contribution to nursing. She died August 1910. Nature law. Assumption of Nightingale's theory. 1. Natural laws. Mankind can achieve perfection. She said nursing is a calling. Nursing is an art and a science. Nursing is achieved through environmental alteration. Nursing requires specific educational base. She also assumed that nursing is distinctive and separate from medicine. These are all assumptions she found out in terms of using her theories. Nightingale's Cano's major concept. Her major concept, one of them was ventilation and warming, light, noise, cleanliness of rooms and walls, health of houses, bed and bedding, personal cleanliness, variety, dietary hopes and advices, taking food, what food, petting, management and observation. She believed in making use of this aspect of nursing that it helped to improve the health care of the patient better than using just drugs. Nursing paradigms. Nightingale's document contains her philosophical assumptions and beliefs regarding all elements found in the metaparadigm of nursing. This can be formed into a conceptual model that has great utility in the practice setting and offers a framework for research conceptualization. Nursing. You see, nursing is different from medicine. And the goal of nursing is to place the patient in the best position, in the best possible condition for nature to act. This can be identified through her assumption. Nursing is the activities that promote health as outlined in the canons, which occur in any caregiving situation. They can be done by anyone. This is her belief and this is her own definition in terms of nursing. The paradigms continue. Person, she sees person. He said people are multidimensional, composed of biological, psychological, social, and spiritual components. And so for you to be able to care for your client in the normal way, you need to manipulate the environment to suit this aspect of the person. Health. Health is not only to be well, but to be able to use every power we have. So she defined health that for you to say you are well, you should be able to make use of every power we have. She also sees disease, she considers disease as disease or the absence of comfort. So whenever there is any form of comfort in a client, it means that client is not healthy. Environment. Poor or difficult environment leads to poor health and disease. Environment could be altered to improve conditions so that the natural laws would allow healing to occur. And that is her belief on her theory of environment. Now, application of Nightingale theory in practice. Patients are to be put in the best condition for nature to act on them. It is the responsibility of nurse to reduce noise, to relieve patients' anxieties, and to help them sleep. As per most of the nursing theories, environmental adaptation remains the basis of holistic care, nursing care. This is the belief of Florence Nightingale, and that is the basis of her theory. Critics. The theory was criticized, and some of the critics are that she emphasized service to doctors. She focused more on physical factors than on psychological needs of patients, which I believe if these physical factors are met, once the healing is taking place, even the psychological aspect of the patient will also be improved. Florence Nightingale provided a professional model for nursing organization. She was the first to use a theoretical foundation to nursing. Her thoughts have influenced nursing significantly. In the care of preterm baby, there are 4 principles of objectives, which are the establishment and maintenance of temperature, the prevention of infection, the provision of the best environment to maintain body temperature, the provision of client environment, and management of a preterm baby using Florence Nightingale. Florence Nightingale theory is known as descriptive theory that provides nurses with a way to think about nursing or way of referencing that causes on patient and environment. Nightingale letters and writing direct the nurse to act on the behalf of the client. Therefore, I'm going to act on the behalf of this my baby, preterm baby, to enable her adopt to normal life. Nightingale view nursing as oriented towards providing fresh air, light, warm, cleanliness, and adequate nutrition. Through observation and data collection, she links the client health with the environment. Nightingale view nursing as one. She ensures aseptic techniques in every procedure carried out in the care of the baby. Ensure personal hygiene of the baby by ensuring that the cold storm is not affected. Change soil linens regularly. Ensuring the environmental hygiene will not allow any staff with influenza infection to attend to the baby. Feeding baby on EBM regularly to boost immunity. As a preterm baby, the diet she can take is milk, so EBM will be given in adequate quantity as demanded by the baby. With the above step of care of the baby based on the Nightingale model, the preterm baby will receive adequate care to maintain her health. Bye now. In conclusion, theories are patterns that guide the thinking about being and doing of nursing. The day-to-day experience of nurses is a major source of nursing practice theory. Nursing theory addresses phenomena of interest to nursing. The focus of nursing, the person or population nurse. Nursing theory, either implicit or explicit, direct all avenues of nursing, including nursing education and administration. Nursing theories provide concepts and designs that define the place of nursing in health and illness care. Through theories, nurses are offered perspective for relating with professionals from other disciplines who join with nurses to provide human services. The major reason for structuring and advancing nursing knowledge is for the sake of nursing practice. Thank you for listening.